I remember meeting James the morning after he was shot. He was agitated, in pain, and pacing my office, his wound still wrapped in gauze. He had so much on his mind that morning, and his priority was his legal obligation. Still, he was angry that he needed to be in court, and frankly, so was I. James, I said, you do not need to be here. I can take care of court. Go home. Take care of yourself. Call me when you can. This conversation I have had countless times over my career with the veteran who tried to delay his chemotherapy, the new mother who had just given birth, the man who was hit by a bus, and the woman with pink eye. Every single one of them prioritized their municipal court matter over their health care.
And I remember meeting Andrew when he came out to the floor of the hospital after having spent 2 weeks in the ICU. He had been shot, sitting in his car, holding his 2-year-old daughter. The bullet went into her chest and out of her back and into his stomach and lodged in his spine. Thankfully, she was fine, but he was now a paraplegic. And having gotten through the acute phase of his illness, he now needed rehabilitation. But a small infraction from several years ago prevented us from being able to get him enrolled in the kind of services that he needed to recover from his injury. Instead of focusing on rehabilitation, he spent days on the phone, mostly on hold, trying to work his way through the system. Eventually, we were able to get him out of the hospital with a charity-provided wheelchair, but without any of the rehabilitation services that he needed to move on and be successful in his new life.
James, Andrew, like so many people who are legally involved, had to make seemingly impossible decisions, ones that could impact their health, their freedom, their lives. And as healthcare providers in the hospital, in the courts, it was our job to give them the information they required to make informed decisions about their wellness. My name is Colleen Smith, and I'm a forensic social worker who's been operating in the New Jersey legal system for over a decade.
And my name is Stephanie Bonne, and I'm a trauma surgeon. I've been working in trauma centers around the country, also for over 10 years. Our relationship started a couple years ago when I picked up the phone and asked to visit the court where Colleen works. That was the beginning of our partnership, and we started by doing a needs assessment. We wanted to know what the relationship is between people's court needs and their healthcare needs. So we did a survey. We found that 20% of the people, all comers to an urban emergency department, have outstanding legal needs that have not been resolved. And of those, over 50% of those people said that they would prioritize taking care of their legal needs over an immediate healthcare concern. This wasn't really surprising to us, but it's also not particularly helpful. There's no one program or agency that we can create that can help these complicated issues across the spectrum of healthcare and legal issues. Then 2020 came and the pandemic hit, and all of the resources of the people in the hospital were focused on taking care of those with COVID.
And down the street from the hospital, the courthouse shuttered. Judges, attorneys, court personnel went home to build a brand new legal system out of their living rooms at a time where our two systems couldn't have seemed further apart. It was our relationships forged before the pandemic that moved us forward. You see, people still needed these systems to work for them, particularly during the most critical public health crisis of our lifetime.
So we thought about how we developed our relationship and what we could do to make things work. At a time where police were issuing hundreds of tickets for violations of stay-at-home orders or other public health orders, we started to think, is this really the best way to go about this? Should we really be policing public health? So what we did is we created an alternative for these police officers and for the court system to take care of these tickets. We built something called Public Health School. It's a 1-hour course that people could take to learn about why it was important that they stay at home, social distance, mask, and take care of other public health needs in the middle of this crisis. With this 1-hour course, it was an alternative to prosecuting those tickets. And in addition to getting those tickets adjudicated, we found that participants in the course told people about what they learned. They went out into their communities and talked about the importance of hand washing, the importance of masking and social distancing. And they also taught about how to manage their own stress in the time of this crisis. The pandemic came and went, and after about a year, the tickets stopped coming for the violations of the public health orders. And we began to think, what else could we do to help people engaged in these two systems?
With telehealth and virtual court dominating the service sphere, the digital divide was a concern in both systems. I had been conducting these pop-up virtual courts in a local shelter and thinking about how to expand to new locations, and thought, well, why not do this together and coordinate our outreach to connect with the people who had the least access to care. So I called up my friends in the courts, and I called up my friends in the social service realm.
And I called up my partners in the hospital and the healthcare system.
Together, we galvanized about 15 interdisciplinary partners who agreed to go out together to deliver preventative medicine, legal needs screenings, and make social service referrals. These partners introduced us to new contributors. Most importantly, people with lived experience in our shelter system. They identified the locations for our outreach, and they created a team of credible messengers who publicized these events and handled attendee recruitment. As time went on, people heard about what we were doing and approached us to join the team as well. Today, this cross-sector outreach has been institutionalized via our county's continuum of care. Our virtual court pop-ups are embedded in our public library and a drop-in center for people with mental health conditions. And our courts have recognized that this community approach can ensure equal access to justice. And our healthcare providers and social service agencies know what to do when someone who they're serving has an unmet legal need.
We started the process thinking that we were going to create a program or an agency, something new that would handle these issues. But what we learned is that it's not about one agency or partnership. What it is about the people and building the relationships. As we worked in the community and in our programs and through public health school, we found that agencies and groups and the community built partnerships together with one another, and that the power of our project was in those partnerships that were built. Sometimes taking care of a ticket or getting a blood pressure check is enough to set somebody on the path to health and wellness. It doesn't have to be a whole program. It really can just be about the partnerships, building those relationships so that the organizations know who to call to help the people that they're serving. When I think about Andrew and his paraplegia and his new life moving forward, I think how much better it could have been for him if he had not had to handle all of his legal problems in that moment.
And when I think about James, I remember the doctors, the nurses, the social workers who could respond to the bullet in his arm and give him the information that he needed to recover at home. But they could not give him permission to follow those orders. That came from me, a social worker in the courts. I am hopeful that one day there will be a system that gives James permission to heal. I don't know what it'll look like, but it will not be a single intervention or program like we once thought. It lies in the relationships we build with James, the people who care for him, the people who work in the systems that he navigates every single day. As healthcare providers, as attorneys, as community members and neighbors, it is our responsibility to build those relationships, step out of our zone, and go into spaces that may not have been initially designed for us to listen: a court, a hospital, a community center. Building and investing in the relationships that will create a system that can respond to a person and not a problem. When I think about the next chapter of legal and healthcare alignment, I look forward, but I also have to look back and remember that this started because a doctor heard about a court that provided social services instead of jail time or fines. And she picked up the phone and asked for a meeting. So I implore you to pick up the phone, call somebody who you just met, or someone who you haven't spoken to in a long time. Join a network of partners where you're not going to be the expert in the room. And take your work to places where you had not originally imagined. Thank you.
Thank you.